Thank you for joining us today for this Reframing Retirement event and today's topic, Medicare Basics, presented by Roma Costanza, Medicare Specialist and State Health Insurance Program Coordinator at the Pikes Peak Area Agency on Aging. We want to thank the Area Agency on Aging and Credit Union for collaborating on this series. Before we begin, we ask that you please keep your microphones muted until we reach the designated times for questions. You can use the chat area to let us know if you have a question. You can also rename your profile so that we can accurately call out the correct person during questions and for our door prizes. You can do this by hovering over the participant button at the bottom to open the participant panel, and then hover over the profile you're in, represented by the word "me" next to it, and then hover over the name, click the three dots, and select Rename. And now it's my pleasure to introduce Pamela Hogard at the Pikes Peak Area Agency on Aging. Pamela, it's all yours.
Thank you, Jared. Are you all feeling good this afternoon? You have your pens and pencils and paper ready to roll, okay? We are going into our last session of our 9th series on reframing retirement. Welcome, some of you. I see some familiar faces, some familiar names, and some are new, I hope. We are ending with Medicare presentation tonight because we are going into open enrollment very soon, and we thought that would be a good opportunity to review Medicare. So just a few words about our agency here. Most of you know, at the Area Agency on Aging, we provide resources, educational programs, and services for the older adult population. In addition, we publish 2 well-known publications, the Yellow Book, which is a great community resource guide for El Paso Park and Teller counties. And we also have the Veterans Benefit and Medicaid Guide. Last but not least, we house the Medicare Insurance Counseling Program, fondly known as SHIP, the State Health Insurance Program, where we offer unbiased information on Medicare and health insurance. So this session is called Reframing Retirement, which is different than last year. So what does that mean? Most of you who've been here before kind of have heard my little jingle about that. But basically, we just wanted to reflect more of what's happening with people in this day and age to be a more accurate representation of what we call longevity. People are living longer and healthier after work. Some of them have 20 to 30 years left, which was much different than back in the 1930s, where the retirement age was 65, where the life expectancy was 65. So if we take a look at life expectancy now, people are living 80s, 90s, and some people are working into their 80s. So it just kind of made sense to relook at this. And so we added a couple sessions this year. And for those of you who have attended all 8, or even some of them, would really like to get your feedback on that, if it was worthwhile, and if it was something that you got something out of. So in this series, this eight sessions, we have reviewed many aspects of retirement and what we hope are going to give you some tools and tricks as you go forward. First of all, we introduced the idea of ageism and how it affects older adults and what you might encounter as you retire. And then we talked about estate planning, documents that you will find that you may need as you go into that part of your life, Social Security benefits, and Medicare enrollment, designing your retirement, having meaning and purpose, enhancing your health and financial considerations as you retire. And last but not least, we are ending today with Medicare 101. So before I go into introducing our speaker this evening, Roma Costanza, I'd like to turn it over to Bree to talk a little bit about N Credit Union, our partnership, and a little surprise.
Awesome. Thank you so much, Pamela. As she said, my name is Bree Shalito. I work for Ent Credit Union, been with Ent for about 13 years, and I'm just thrilled to work here, but also thrilled to partner with the Area Agency on Aging for this series in our 9th year. Kind of sad it's coming to a close, Pamela. I thank everyone who's been with us for these 8 sessions. And even if you were able to only join 1 or 2, that's been great. But we're so proud to partner with this series because Ent was founded in 1957. And what we've always been about is providing education to our communities. We wish to improve the financial lives of our members and members of our community. And that's really the basis of what we do. So partnering with this series to educate folks about retirement is absolutely right in line with our mission. ENT is Colorado's largest credit union, and truly we just serve what credit unions do, which is people helping people. We're excited to do that. This series certainly helps us do that with speakers like Roma tonight. So excited for this series to come to a close, and hopefully you join us for our 10th year, and as Pamela said, provide us with some feedback. We're also excited to offer a door prize. So if someone here tonight, if you're with us at the end of the session as well, we'll actually do a live drawing for a $50 e-gift card of your choice. That could be to Amazon, Walmart, anywhere you can think of that we can get an e-gift card that will be your choice. So that'll be right at the end with a live wheel. So excited to provide that to someone here tonight, and just thank you all for being here. And I'll give it back to Pamela to introduce Roma.
Cool. Thank you very much, Bree. We appreciate it. So Roma is a Colorado Springs native. She's been assisting consumers as a certified state health insurance program and senior Medicare patrol counselor and program coordinator, for a 9-county region of Colorado for over 23 years. She is contracted as the Colorado State Medicare subject matter expert and a trainer for Colorado SHIP counselors for the Division of Insurance. That means she trains counselors throughout the state. SHIP is a federally funded program, which many of you may know that provides unbiased education and Medicare counseling, and she'll talk more about that. And her presentation is going to give you an overview of all the things basically concerned with Medicare, such as eligibility, enrollment, costs, and benefits. There are other sessions that we have where Roma goes into more detail. It's a 4-part series for Medicare, and that is also provided throughout the year. They have finished for 2023, but they will be back in stride next year for 2024. At any rate, I'm going to turn it over to you, Roma. It's all yours.
Thanks, Pamela and Bree and everybody else for letting me speak tonight and talk about Medicare, and for joining us. Let me share my screen here. Can everybody see that? Perfect. All right. So again, thank you for joining us. We appreciate you coming. This is our Medicare Who Me presentation, everything you never wanted to know about Medicare. This is kind of just a brief overview of everything you never wanted to know about Medicare. And as Pamela mentioned, we do have other presentations that dive a little deeper into the different aspects of Medicare. But tonight we're going to get you a starter presentation. And if you want more information, we are always available to help. So as you all probably know by now, we are with the Area Agency on Aging through the Pikes Peak Area Council of Governments. We serve under the Area Agency on Aging a total of 3 counties, El Paso, Park, and Teller. And we work to advocate and create systems and programs that allow people to stay in the community. And we are also SHIP counselors. I am the coordinator for the SHIP program in Colorado Springs. And as Pamela mentioned, we cover a total of 9 counties. Every county in every state has access to a SHIP counselor that provides free, unbiased information and education on all things Medicare or related to Medicare. I've listed both our Colorado Springs number, which if you call that number from any of our 9 counties will come to this desk, or our statewide toll-free number, and call that number. It'll route you to the SHIP office closest to where you're calling from. So tonight we're going to cover the 3 primary parts to Medicare: Medicare Part A for hospitalization, Part B for medical insurance, and Part D for prescription drug coverage. We'll also talk about Medicare Advantage plans, also sometimes referred to as Medicare Part C. But we're going to start with who runs Medicare. So it is actually Social Security that determines who is eligible for Medicare. And that eligibility is based on paying into the tax system. So you have to contact Social Security to enroll in Medicare. They determine if you're eligible for Medicare. They process your enrollment. They provide you your initial Medicare cards. They are available at brick and mortar locations throughout different regions. You can call them toll-free at their national number, which I've listed on the slide, and they are available 7 a.m. to 7 p.m. in all time zones, or you can go to the Social Security website, ssa.gov. Once you're enrolled in Medicare, if you have any questions about your benefits, your coverage, claims, that kind of stuff, you would contact the Centers for Medicare and Medicaid Services, because Social Security will want nothing to do with you. So it is CMS, or the Centers for Medicare and Medicaid Services, that actually administers the Medicare program. They determine what benefits will be covered. They process claims. They pay the providers directly. Medicare does not have brick and mortar locations. You cannot walk into a Medicare office, but you can contact them 24 hours a day, 7 days a week, 365 days a year, through their national toll-free number. You can go to their website, medicare.gov, and chat with them. But yeah, you cannot talk to anybody in person because they don't have local offices. So who can have Medicare? So if you are a U.S. citizen turning age 65 or older, and you contributed to the Social Security tax system through payroll taxes or through the railroad retirement system, you will be automatically eligible for Medicare at that age 65. You can be automatically eligible for Medicare at any age if you've been determined to be disabled by Social Security and have received at least 24 disability, Social Security disability checks. You can also become eligible for Medicare at any age if you are diagnosed with end-stage renal disease or kidney failure and are receiving dialysis. If you're diagnosed with Lou Gehrig's disease, also known as ALS. And then any lawfully admitted resident alien who has resided in this country for at least 5 consecutive years is eligible to purchase Medicare. So when should you enroll in Medicare? Well, these days you don't have to be retired, and many people are not retired when they become eligible for Medicare, typically at age 65. But there are enrollment periods you need to be aware of based on that initial eligibility of turning 65. So age 65 is still your initial eligibility for Medicare, even though eligibility for Social Security income has increased. And now it is age 66 and like 10 months as your full retirement age. Medicare has stayed the same at 65. So if you're getting ready to turn 65 anytime soon, your initial enrollment period into Medicare is a 7-month window that starts up to 3 months prior to the month of your 65th birthday, includes the month of your 65th birthday, and ends up to 3 months after the month of your 65th birthday. That is your enrollment period window to enroll in Medicare without penalty. Other times you may be able to enroll, which we're going to talk about next, but in some of those situations, you could incur a higher premium for Medicare in the form of a penalty. So this is a quick chart on the different Medicare enrollment periods. So you've got the initial enrollment period, then there are special enrollment periods. Special enrollment periods are for people who delay enrollment into Medicare because they are still actively employed, have employer group health coverage through that employer, and that employer is at least 20 employees or more. That is honestly the only excuse Social Security will accept for not enrolling in Medicare at initial eligibility without penalty. If you delay enrollment into any part of Medicare, and you can delay into A or B or both, although many people do go ahead and enroll in A because it's at no cost. If you delay enrollment into Medicare, based on the fact that you're still working and you have employer group health coverage, when you stop working, you will have an extended window of time to enroll in Medicare without penalty from the time you quit working. And that's going to be an 8-month window from the time you stop employment. You can also enroll in Medicare anytime while you're still actively employed. But the special enrollment period, again, is only going to apply to people who delayed enrollment into Medicare based on active employment with employer group health coverage. That also includes the spouse of the active employee who is covered under their active employer group health coverage. If for some reason you don't enroll during your initial enrollment period, you don't qualify for a special enrollment period under that circumstance, Medicare will still allow you to enroll in benefits any year down the road during what they call the general election period. The general election period is every year from January 1st to March 31st. If you enroll during that time frame, your coverage will begin the first day of the following month, but you're likely going to be penalized for not having enrolled in Medicare sooner. And we will talk about that penalty and how it works. Quick glance of what the Medicare card looks like these days. I usually call it the red, white, and blue card. It will simply have your name, your Medicare number, which is now just a random series of letters and numbers, and it will indicate when your Medicare Part A and Part B start. It will only ever indicate these 3 bits of information. Hopefully you'll have access to the handouts if you didn't receive them in your reminder email this afternoon of handouts that I am referencing throughout this presentation. And a couple of those handouts are from Social Security that kind of gives you an idea of what kinds of things you can do at the socialsecurity.gov website and how to enroll in Medicare through the socialsecurity.gov website, which honestly these days is going to be your most effective way to try and enroll in Medicare versus going, say, to your local Social Security office. Social Security still hasn't recovered from short staffing during the pandemic. And so they can get quite behind in scheduling even appointments to get people in to apply for Medicare. So if you can manage to enroll in Medicare online through the Social Security website, not only are your chances better of getting that process done quickly, but your chances are better of getting it done in a timely manner. Let's see. Another handout I hopefully was included in your email is from Medicare.gov on how to create a personalized Medicare account. Social Security also encourages you to create your own personalized Social Security account. Both accounts are very secure, although Social Security's personalized account would be more secure and requires a little more security process. But both accounts are really easy to create. There are advantages to having your own personalized account, both at Medicare.gov and socialsecurity.gov, but neither entity require that someone create these accounts. Again, there are advantages to having them, but they are not required to do any of the business that you need to do either at Social Security or Medicare. So with that, I will pause real quick to take, am I taking questions, I hope? I will pause real quick because I have a question in the chat.
You can take questions if you want, Rama, now, or you can wait till later, whatever you prefer.
If there's only 1 or 2 here and there, I'll just go ahead and take them. If they start filling up, then we'll suggest wait till the end.
Okay.
So the question I have in chat right now is, when we get to questions, you said lawful aliens can purchase if they have been here 5 years. My husband has been paying into the system for over 20 years. Will he have to buy it? If someone has been lawfully present in this country and they have a Social Security number, they've been paying taxes through employment, they will become eligible for Medicare at 65. They will not have to buy it. Well, they'll have to pay their premium like everybody else, but it's not going to be based on just being a resident alien that's lived here for 5 years. If someone's paid taxes through work payroll taxes, then they will be eligible to receive it based on that. Okay. So now we're going to talk about the different parts of Medicare, and we're going to start with Medicare Part A. Medicare Part A, and my best rule of thumb for people is Part A is for hospital, Part B is for everything else. So Part A, we're going to talk about inpatient coverage. Things to consider before enrolling in Medicare Part A is, first of all, you should be aware that if you are already collecting a Social Security income for any reason, whether it be retirement, early retirement, disability, if you're collecting a Social Security income when you become eligible for Medicare, Social Security will automatically enroll you in Medicare A and B. And that's specifically because you are collecting an income. If you are not collecting a Social Security income and you want to enroll in Medicare when you first become eligible, it will become your responsibility to contact Social Security and let them know you want to enroll, or simply go to the website and fill out the enrollment form. Again, if you're actively employed and you are covered by employer group health benefits, for yourself and or your spouse. You can delay enrollment into Medicare in favor of that employer coverage until you stop working. But if you are not going to enroll when you first become eligible during that initial enrollment period, and you're not actively employed or covered as a spouse through active employment group health insurance, when you go to enroll, you may be penalized, pay a higher premium. For most people, Medicare Part A is not going to have a cost. Medicare Part A for most people is premium free. In order to get Medicare Part A at no cost, you have to have had a work history of paying payroll taxes, and that is kept track of by Social Security. And Social Security requires that you have earned or paid into the system for at least 40 working quarters, which is basically the equivalent of 10 years of work history, in order to qualify to get Medicare Part A at no cost when you become eligible. Now, that 10 years of work history can be accrued at any point in your lifetime. So if you went straight from high school or you started working while you were in high school, as soon as you earned the first 10 years of work history, so by the time you're 25, you've already had 10 years of work history. At that point, you've earned Part A at no cost when you turn 65. Or if you've been a stay-at-home parent and you only worked part-time jobs here and there, every 3-month work period that you pay taxes into the payroll system qualifies as a quarter. And as soon as you've accumulated those 40 quarters over your lifetime, you get Part A at no cost. If for some reason you don't have 40 quarters of work history paid into the system, when you become eligible at 65, you can still purchase Medicare Part A, but it's not cheap. Medicare Part A premium just for Part A right now in 2023 can be as high as $506 per month. So if you are in a situation where you don't have enough quarters, and honestly, if you're not sure, you need to contact Social Security and ask them, because they're the ones who keep track of that. If you're not sure, then you need to call them. But if you know for a fact that you don't have enough quarters and would have to buy it, you might also want to ask Social Security about whether or not you could be eligible for Medicare Part A at no cost through a spouse's work history. Or again, if you were that stay-at-home parent and didn't have enough work history, you're still married to your spouse, and they qualify for Part A at no cost, you can certainly try and get benefits through that spouse's work history because you've been married for at least 10 years or longer. So what does Part A cover after all that? So again, Medicare Part A is going to cover primarily inpatient services. The most common service is going to be inpatient hospitalization. If you have to be hospitalized and you're admitted as a patient for any medical reason, Medicare Part A will cover the entire cost of any inpatient hospitalization, regardless of what you're there for. They'll cover the entire cost except for a deductible. And this year, that deductible is a flat $1,600 per admission. And that covers you up to 60 consecutive inpatient days stay in the hospital. That deductible is applied per admission, not per year, per admission. So it is possible to incur that deductible multiple times in a year if you have multiple inpatient hospitalizations. Again, that covers you up to 60 consecutive days in the hospital. If for some reason you're in the hospital longer than 60 consecutive days, then Medicare will start applying what they call a coinsurance, meaning Medicare will continue to pay everything for that continued hospital stay, everything except for $400 per day, starting at day 61. And then if you're really, really unfortunate, you're still in the hospital after 90 consecutive days, you start going into what they call lifetime reserve days, and that coinsurance goes up to $800 per day that Medicare will not pay. Medicare defines a hospitalization benefit period as a 90-day benefit period. And you would have to have at least 60 days between the time you're discharged from a hospitalization before you're readmitted for another hospitalization before a new 60-day or 90-day benefit period would start, and they would apply a new deductible. If you have to go back in the hospital with less than 60 days between discharge and readmission, you would likely go back into the hospital under the same benefit period you were discharged under, and you would start your benefit period where you left it off when you were discharged. The same rules apply to psychiatric inpatient hospitalization. Psychiatric hospitalization does have a lifetime limit on how many days Medicare will cover at 190. There is no limit for medical hospitalization for physical medical needs, but there is a limit for psychiatric hospitalization. While you're in that hospital as an inpatient, again, all services are covered, whatever you need, as far as what the reason you're in the hospital for. However, there are some things that Medicare will not pay while you're inpatient in the hospital. That includes a private room, unless it's deemed medically necessary and ordered by a doctor, or even in a situation where perhaps there wasn't other space available. But if you just want a private room because you want a private room, that would not be covered. No part of Medicare covers any of the first 3 pints of blood you might receive or need. Medicare will start paying for blood replacement at pint number 4, but again, no part of Medicare covers any of the first 3 pints of blood replacement you might need. Part A will not cover private duty nurses or room sitters, nor will it cover what they call self-administered drugs. Self-administered drugs are typically going to be something that you might get a bill for on the day of discharge. Well, you won't get the bill on the day of discharge, but it'll be based on the day of discharge. If you've been inpatient in the hospital, on the day you're being discharged, you're no longer considered inpatient. But if it's taking them hours and hours and hours to discharge you, and in the meantime, it comes time for you to take regularly scheduled maintenance medications, and a nurse comes into the room and brings you a cup of pills because it's time to take your pills, even though you're no longer a patient, and you take that cup and you swallow those pills, you just self-administered drugs that are not going to be part of an inpatient stay. In that situation, the hospital could technically bill you privately for the cost of those medications. On the other hand, you could still turn around and take that bill and submit it to a Medicare Part D plan for some reimbursement if that happens. The other thing to be aware of about an inpatient hospitalization is you should be aware that, especially in an emergency situation, if you go to the hospital, you may not always be admitted as an inpatient. Many times people can be in a hospital for multiple days and never have been officially admitted because they are considered under observation. And observation stays in the hospital are billed under a different part of Medicare, under a different formula of payment. The hospitals are required to provide you with written notice within 24 hours of being put in a room or unofficially being admitted, to let you know whether you are admitted or still under observation, and why. So be aware of that if possible. Just because you're sent to a room upstairs and you've been there for more than 24 hours does not mean you've been admitted. Medicare Part A also covers skilled facility rehab stays after hospitalization. In order for Medicare to pay for rehab or recovery in a skilled facility, Medicare does require that that person have been admitted as an inpatient in the hospital for at least 3 days or more before they're discharged into a skilled facility for rehab or recovery. If you meet that 3-day or more requirement and the doctor discharges you into a skilled facility for rehab or recovery, Medicare will pay for you to be in that facility 100% for the first 20 days. If you're still in the facility getting rehab or recovering after 20 days, Medicare will continue to pay for that facility stay, everything except for $200 per day, starting at day 21 up to a total of day 100. So Medicare will pay all or part of up to 100 skilled facility consecutive days stay at a time, as long as your condition is continuing to improve while you're in that facility. Medicare considers that 100-day period a benefit period, and you get an unlimited number of these benefit periods as often as you need them for the rest of your life. If you don't meet that 3-day or more inpatient hospitalization before you're discharged to rehab, Medicare will not pay for you to be in that rehab after a hospital stay. So be aware of that. If you're still in the skilled facility and you have not gotten well enough to go home, even after 100 days of rehab, Medicare no longer cares why you're there, basically, because at that point, Medicare benefits cut off starting at day 101, and Medicare will consider your continued stay at that facility as custodial, or basically long-term care. And Medicare doesn't provide long-term care benefits. They only cover medically necessary benefits. So again, if you've been in the hospital, you got discharged to a skilled facility for rehab or recovery, and you've been there for 100 days, but still have not gotten well enough to go home, Medicare basically considers that as you're not likely to get well enough to go home, and they will stop covering that stay. Or if you've been in the facility for 3 or 4 weeks, you've gotten better and can go home, that's when Medicare coverage will stop. Or you've been in the facility for 3 or 4 weeks or however long, and you're not getting better at all, Medicare coverage could stop at that point as well. The last benefits typically covered under Medicare Part A are the home health care benefit and hospice benefits. Both of those services do require that a doctor certify someone's eligibility, and there is specific eligibility criteria to be eligible for those services. But if you qualify, they're at no cost to you. Medicare covers them at 100%. Deductibles do not apply. There are some limits to some services based on different situations, but theoretically, you could be on either of those benefits with no limit as long as you continue to be eligible under that criteria that Medicare sets forth, and the doctor certifies that to Medicare basically every 60 days. But again, as long as you meet those eligibility criteria, any of the services covered under those two benefits are covered at 100%. And that could be home health care after a hospitalization, or under Part B, not requiring a hospitalization. The hospice benefit, of course, is for end-of-life care that is designed to make someone comfortable in an end-of-life situation and covers all of those costs. So with that, I will see if there are any questions before I move on to Part B real quick.
I don't see any, unless you've got some directly to yourself.
Nope, I'm not seeing any. And we will, we'll see about the PowerPoints. So that was Part A in a nutshell. Medicare Part B is the other part of Medicare. Medicare Part B is going to cover basically everything that's not inpatient hospitalization of some sort. Things to take into consideration, again, if you are already collecting a Social Security income for any reason, you will automatically be enrolled in both A and B. If you're actively employed or the spouse of an active employee with employer group coverage, you can delay enrollment into Medicare. And most people, well, honestly, pretty much everyone will have to pay a premium for Medicare Part B. You cannot earn it at no cost. So everybody has to pay for Part B, even though most of us earn Part A at no cost. Some situations may require that you have both Medicare A and B, and those would include if you want to buy a Medigap or Medicare supplement, if you want to join a Medicare Advantage plan, if you're eligible for TRICARE because you're retired military becoming eligible for Medicare, are some of the more common scenarios. For any of those scenarios, you have to have both A and B of Medicare. You can't just have one or the other. I also get the question from veterans a lot as to whether or not they should enroll in Part B if they are getting all of their healthcare needs taken care of through the VA. And typically, my answer is probably they want to enroll in Medicare A and B. because their concern is that they have to pay for something that they may not ever use. But there are, again, advantages to having both access to Medicare and to the VA system. And if someone doesn't enroll in Medicare Part B when they're first eligible during that initial enrollment period because they are accessing the VA, if they need or want for any reason down the road to enroll in Medicare Part B, they'd have to wait for their general enrollment period, and there could be penalties for not having enrolled sooner because using the VA does not fall under that special enrollment situation of being actively employed. Again, if you're still actively working, and I keep pushing that point because it literally is the only excuse Social Security will accept, that special enrollment period is up to 8 months after employment ends. But of course, you can also enroll in Medicare anytime while still actively employed. And then that general enrollment period allows anybody who's eligible to enroll during that January 1st through March 31st, but likely to incur a late enrollment penalty if you're enrolling during that time frame. So how much does it cost? So the base Medicare Part B premium for most people this year, 2023, is $164.90 per month per person. That premium is automatically deducted from a Social Security income if you're receiving a Social Security income, or it could be deducted from a railroad retirement check, or even potentially a federal government pension, or even a local public employee pension. If you're not collecting any of those sources of income, then you would have to arrange to pay Medicare or Social Security directly for that premium if you choose to enroll. Late enrollment penalties, if incurred, last forever. And the way they're calculated is if you do not enroll during your initial enrollment period, you did not fall under a special enrollment period that would allow you to delay enrollment into Medicare, and at age 70, you decide it's time to enroll in Medicare because now you might need to start seeing doctors or something. Medicare is going to look at how many 12-month periods you did not enroll in Medicare but could have or should have, and they're going to add 10% for every 12-month period you did not have Medicare. So it accumulates. So if you wait 5 years, you're going to have a 50% penalty. They're going to multiply 50% by whatever the Part B premium is the year you enroll. So if you were enrolling this year, 5 years late, it would be 50% times $164.90. Whatever that comes out to would be tacked on top of that year's Part B monthly premium every month forever. Penalties are monthly and forever and can add up quite quickly the longer you wait to enroll. And that's going to be based on the baseline premium that most people will pay. Under Medicare Part B, you do have some out-of-pocket potential costs. Medicare Part B also has a deductible, but the Part B deductible is annual, one time a year, $226, a drop in the bucket compared to most deductibles these days. Once that deductible is met for the calendar year, then Medicare Part B will typically pay for services at an 80-20 split, meaning Medicare will pay 80% of the approved amount, and then the 20% balance could be your responsibility. Also, Medicare Part B premiums, that $164.90, when I say most people are going to pay that amount, when I say most people, I mean people who have an annual income of less than, for a single person, $97,000 or $194,000 for a couple. That what that is Medicare premiums are now means tested, meaning the more income or the higher income someone may have, the higher premium someone may have to pay for Medicare when they become eligible. So these are the thresholds. If you have an annual income of just under $100,000 for a single person or higher, then your penalty could, or your higher premium could potentially be higher as well. So the more you make, the more you pay, is the way it works these days. And so again, the thresholds are here, as well as the amount of higher premium that you would have to pay. Medicare and Social Security are going to base who has to pay this higher premium on income tax filings. and they're going to base it on the most complete income tax filing year, which if you're enrolling in Medicare today would basically be your 2021 taxes. If for some reason you had a higher income in 2021, but that income has been reduced because you retired or whatever in 2023, because they have to go by complete IRS tax filings, you may have to pay a higher premium unless you can prove why you shouldn't. But when they look at your income the next year, because they review this every year, and your income has gone down because you stopped working, then that higher premium will also go down the next year. So it's not forever. So what do you get for your money? Basically, Medicare Part B is going to cover everything not considered part of an inpatient hospital stay. It's going to cover any and all types of doctor's visits, all your x-ray and lab work, including PET scans and CT scans, etc. It covers medical, surgical, and anesthesia services, and Medicare does pay for medical second opinions. Medicare Part B pays for blood starting at pint number 4, because remember, no part of Medicare covers the first 3 pints. Part B covers all your emergency ambulance transportation, has to be a medical emergency, covers all your annual vaccines, including the flu shot, the pneumonia shot, the shingles vaccine, and I'm sure COVID vaccines will be added to that list within a year or two. Covers all your outpatient physical, occupational, and speech therapies. Part B covers durable medical equipment such as walkers and canes and wheelchair and oxygen that someone might need at home. And there is limited coverage for other types of services such as chiropractic, podiatry, and optometry. The key for Medicare to pay for any of these services is medical necessity. There has to be a medical need for you to get a service for Medicare to want to pay for it. That medical necessity is determined by your doctor. It's the doctor's responsibility to submit to Medicare the medical reason why that doctor feels you need to have a service. And as long as the doctor is able to justify that need based on diagnosis or what have you, then Medicare will pay for your medical needs. If for some reason the doctor does not establish that medical necessity, that need for a service, then Medicare is likely not going to pay for a service, even if it's a covered benefit. Medicare has also jumped on the preventive service bandwagon, meaning they are happy to pay for at 100% a lot of preventive services, including cardiovascular screenings, colorectal cancer screenings, diabetic screenings, services and supplies, all of that kind of stuff. And it's quite an extensive list of preventive services that Medicare does pay for. Medicare does not still pay for a routine physical, but what it will cover is a Welcome to Medicare preventive visit, which is an in-depth discussion with your doctor that you get to access within 12 months of getting Medicare. But if you don't use that visit, you still get an annual wellness review, which is just, again, an in-depth conversation with your doctor about the previous year. If you wanted a more complete list of preventive services Medicare does pay for, you can go to the Medicare and You website and click on the Medicare and You handbook. And within that handbook, there's like a 20 or 30 page section that details all the Medicare preventive services that are covered at 100%. And they're all going to be indicated with a little blue apple symbol. All right, so that is Part B in a nutshell. I don't see any questions about any of that. So, and again, we will have time for questions at the end. So now that you have Medicare Part A and Part B, you have some decisions to make. And those decisions are primarily going to surround whether or not you want to get additional coverage to go with your Medicare A and B, such as a Medicare supplement, also known as a Medigap, or you can choose to enroll in a Medicare Advantage plan, again, sometimes referred to as Part C. You may also have the option of a retirement health benefit being extended to you, or something like that. But for today's purpose, we're going to talk about the 2 primary commercial options that are available to anybody who becomes eligible and enrolled in Medicare. And we're going to start with the Medicare supplement or Medigap coverage. So Medigap insurance is a type of insurance that's sold by a private insurance company. It is a private insurance policy that you purchase, but is specifically designed to coordinate with Medicare A and B. These policies must follow all federal and state laws. Policies must state on the written policy Medicare supplement insurance. The term Medigap refers to the thought process that this kind of insurance covers the gaps in your original Medicare, meaning the cost that Medicare doesn't pay. Medicare supplement policies are standardized, meaning there are a limited number of levels of benefit you can purchase, and those levels of benefit are set in stone nationwide. So every company that sells this kind of insurance anywhere in this country sells these same standardized levels of coverage. But even though the levels of coverage are standardized, costs will vary from company to company, plan by plan, or level of coverage to level of coverage, be based on your zip code, could be based on whether you're male or female, smoker or non-smoker. All of those kinds of things will affect how much you have to pay for this kind of coverage. Medicare supplement or Medigap only works as a secondary to original Medicare A and B. If you have other types of coverage, you don't need or can't get a Medigap or Medicare supplement policy. For example, if you are already enrolled in a Medicare Advantage plan, you cannot also have a Medicare supplement. If you are enrolled in an Advantage plan or are going to drop that plan to get a supplement, you can do that, but you can't have both at the same time. If you have other creditable coverage, such as a retirement benefit from your employer, or if you're retired military and have access to TRICARE and TRICARE for life when you get Medicare. If you have those kinds of options, you definitely want to take a hard look at them to see if they're going to be adequate coverage to go with your Medicare, instead of purchasing additional coverage such as a Medicare supplement. When you have original Medicare and a Medicare supplement policy in place, Medicare is still your primary coverage, and Medicare is good anywhere in this country and or our territories with any doctor, hospital, or medical provider that accepts original Medicare for any medical need, period. So it is the most portable option to have original Medicare, and original Medicare with a supplement, especially if you travel or if you go on family visits for extended periods. It travels much, much better than other options because it's good everywhere. So buying a Medigap policy, it does require that you, again, are enrolled in both A and B of Medicare in order to be eligible to get this coverage. And there are timeframes or enrollment periods to get this kind of coverage without question, called a guarantee issue period. Basically, a guarantee issue period is for people who just become eligible and enrolled in Medicare for the first time in most cases, where you're guaranteed to be able to purchase this kind of coverage at any level from any company with no questions asked. But if you miss your guarantee issue period or window to buy this kind of coverage without question, and you want to buy it down the road, if you have pre-existing health conditions, you could have a problem purchasing that kind of coverage because you would be subject to underwriting. The same rules that apply to the Affordable Care Act that states that companies can't underwrite do not apply to Medicare supplements because they provided a guarantee issue period that kind of bypassed that for many, many years prior to the Affordable Care Act. In Colorado specifically, guarantee issue is also extended to people who become eligible for Medicare who are under age 65. That is not the case in every state. Some states do not extend that guarantee. And so people who become eligible for Medicare under age 65 due to disability or what have you would not have the ability to purchase a Medigap policy to go with their Medicare. But in Colorado, we do have the same guarantees for under 65 as we do over 65. So honestly, for most people, that is going to be the best time to purchase this kind of coverage. The guarantee issue period, where a company cannot turn you down for any reason whatsoever with whatever plan you want to purchase, lasts for 6 months. 6 months from the time you have both Medicare A and B in place. Once that 6-month clock starts ticking, it cannot be stopped. Once it expires, it expires. Once it's gone, it's gone. And again, during that 6-month period, you are guaranteed to be able to purchase any level of coverage from any company you choose without question. They cannot turn you down. But if you miss that guarantee issue period, you can still try and purchase this kind of coverage. But if you have pre-existing health issues, the insurance companies may not like your health condition and may choose not to sell you a policy. So the healthier you are, the more likely you are to be able to purchase this kind of coverage outside of this guarantee issue period. But if you have pre-existing health issues, it could become problematic. There are other certain special enrollment period opportunities that you might fall under that would give you a brief period of guarantee issue into this kind of coverage under specific situations. For example, any type of involuntary loss of other creditable coverage could open up a special enrollment period that would give you guarantee into a Medicare supplement. Loss of credible coverage could include employer coverage, retirement health benefits that were designed to coordinate with your Medicare, COBRA, those kinds of things, if they go away, would provide a window of guarantee issue into a supplement because those losses were no fault of your own. If you are enrolled in a Medicare Advantage plan and you are using a test drive, which we'll talk about more in a minute, or you fall under another situation where you lose that coverage through no fault of your own, then it would provide a small window of guarantee issue into a supplement. And we'll talk about that in more detail in a minute. Things that are not covered by a Medicare supplement or Medigap are going to be the same things not covered by original Medicare. Long-term care, custodial care. Medicare still doesn't cover dental or routine vision or routine hearing appointments or hearing aids, private duty nursing, outpatient drugs, because that would be covered under Part D. So basically, if it's not covered by Medicare or paid for by Medicare, it's not going to be covered by your Medigap. It's not there to replace Medicare or pay when Medicare doesn't. It's there simply to pick up whatever balance Medicare left over after they paid their part first. Hopefully, if you get the handouts that go with this presentation, or you can get to the links that will take you to those handouts, this is a chart of the different levels of coverage you have to choose from when you are purchasing a Medicare supplement. And it just outlines what benefits are covered under each plan level after Medicare pays their part first. And we also included this handout that's put out by the Division of Insurance up in Denver each year. They're running a little bit behind on this handout this year, but this is the most still current document. And this document will list all of the companies licensed to sell that kind of insurance in the state of Colorado. It'll tell you what levels of coverage each company sells, and it gives you a ballpark idea of what each company charges in monthly premium for each level of coverage they sell. So it can be a really handy handout to have if you're looking for this kind of coverage. And that's Medicare supplements or Medigaps in a nutshell. Medicare Advantage plans are the other option that people have when they are first getting Medicare as an opportunity or an insurance coverage option. Medicare Advantage plans are an entirely different kind of animal from Medicare supplements or Medigaps. Medicare Advantage plans, for people who enroll in a Medicare Advantage plan, the Advantage plans are plans that are offered by private insurance companies as well, but these companies have contracted directly with Medicare to act on Medicare's behalf and provide Medicare benefits directly to the patient. When you enroll in a Medicare Advantage plan, you still have original Medicare A and B. You still have to pay for Medicare Part B premiums, but the Advantage plan actually becomes your Medicare provider. And so all medical needs must go through that plan and that plan's processes. That's why sometimes Advantage plans have been referred to as replacement plans. So the Advantage plan becomes your Medicare A and B and usually D. But regardless, you still have all your Medicare rights and protections. All regular Medicare services are required to be covered in these plans. And they're called Advantage plans because in many cases, the plans can also offer additional benefits for probably services that are not typically covered by original Medicare, such as some dental, some routine vision, hearing services, gym memberships, and as time goes on, the list goes on of what extras these plans can offer. Most Part D plans will include Part D prescription drug coverage. Not all of them, but most of them as part of the package at no extra cost. Keep in mind that prescription drug coverage is usually included with Medicare Advantage plans. Medicare supplements or Medigaps do not include Part D, and you would have to purchase a separate Part D plan in addition to Medicare and the Medicare supplement, whereas with the Advantage plans, it's kind of all rolled into one package. Eligibility criteria. There's a little bit more eligibility criteria to enroll in these plans. For a Medicare Advantage plan, you can only purchase an Advantage plan that's available in the county that you reside in or your service area. Again, you must be enrolled in both A and B of Medicare. And outside of your initial eligibility or enrollment period, you can only get into or out of these plans during other official enrollment periods. So the enrollment periods for Medicare Advantage plans and Medicare Part D standalone plans, just drug coverage. So you have the initial enrollment period, which is going to be the same as when you enroll in Medicare for the first time. It's that 7-month window. So if you're enrolling in Medicare for the first time during that initial enrollment period, you can also enroll in a Medicare Advantage plan or standalone drug plan at the same time so that everything starts at the same time. So you coordinate them. But if you don't enroll during that initial enrollment window into an Advantage plan or Part D plan, you still have other enrollment periods to take advantage of, specifically the annual election period. Typically, we call it simply Medicare open enrollment, which starts in a couple of weeks. If you're an Advantage plan, you also get an additional enrollment period just for people in Advantage plans, and then special enrollment periods. So again, the annual election period, or open enrollment as we always call it, is October 15th through December 7th every year. And during that October 15th through December 7th window, you have an opportunity to get into an Advantage plan or Part D plan, get out of an Advantage plan or Part D plan, or switch from one Advantage plan or Part D plan to another one. Any change you make during that time frame goes into effect automatically January 1st. The Medicare Advantage open enrollment period, again, is specifically for people who are enrolled in an Advantage plan as of January 1st each year. And if you're enrolled in an Advantage plan on January 1st each year, you have an additional enrollment period that is January 1st through March 31st. And during this enrollment period, you can choose to either get out of your Advantage plan and go back to original Medicare, or you can switch from the Advantage plan you're in to a different Advantage plan. Any change you make goes into effect the first day of the following month. If you're not enrolled in an Advantage plan on January 1st, this enrollment period does not apply to you, because you can't use it for anything except for getting out of a plan you're already in or switching to a different Advantage plan. Special enrollment periods, again, are going to be for Medicare Part D and Advantage plan purposes, are going to be for situations where you are involuntarily losing your coverage. For example, a special enrollment period with an Advantage plan would be if you are enrolled in an Advantage plan, say you enrolled in a plan in El Paso County, and you decide to move to Teller County. You cannot take the plan you enrolled in El Paso County with you. When you get to Teller County, you can choose to enroll in a plan that's available in Teller County, or you would have a small window of guarantee issue into a Medicare supplement. If your Advantage plan decides to leave the county, you don't leave, but they leave. That would also provide you an opportunity to get into a different Advantage plan or have guarantee issue into a supplement, or any other type of loss of credible coverage. The other biggest special enrollment opportunity for Advantage plans is what they call the test drive or trial right. Because Medicare Advantage plans have become so prolific in such a short period of time, and between that and the way that they're marketed for many years, there's a lot of confusion and misunderstanding about Advantage plans and what they do and how they cover you. Because of that, Medicare has created this test drive or trial right rule that says that if you enroll in an Advantage plan when you first enroll in Medicare, we're going to let you test it out. And that test drive can last up to 12 months. If you decide at any point within that 12-month period that that plan is not for you, Advantage plans are not for you, you can drop that plan, even if it's outside of the open enrollment period, and still have guarantee issue into a Medicare supplement under this test drive. The other way you can use the test drive, and this test drive is only good for people who are becoming eligible and enrolled in Medicare at age 65. The other way you can use this test drive is if you enroll in Medicare at age 65 and you enroll in a Medicare supplement policy from day one, and you maintain a Medicare supplement policy, you don't have any breaks in actual coverage. Doesn't have to be with the same company, just no breaks in actual coverage for however many years. And then you decide one year all of a sudden that you want to try an Advantage plan. You can drop the supplement, enroll in an Advantage plan during the annual open enrollment period, get the same 12-month window to try it out, see if it works for you. And if you decide within any time within that 12-month window that Advantage plans are not for you, you're guaranteed to get your supplement back without question. So those are the most common ways you can get a special enrollment period with an Advantage plan. Out-of-pocket costs are calculated differently with Advantage plans, but again, everybody has to pay their Part B premium regardless of what other coverage you may enroll in with Medicare. Many Advantage plans in Colorado have 0 monthly premium as long as you're paying for Part B. In exchange for that 0 or very low monthly premium, you will have other out-of-pocket costs when you are enrolled in an Advantage plan and use services in the form of copays and or deductibles and coinsurance. So the way they pay the Medicare providers and the way you pay the Medicare providers is significantly different than a Medicare supplement. The way they work in general is, again, you will get all your Medicare covered services, but you get them through the plan that you enroll in. Plan will likely include drug coverage, your Part D, that is considered your Part D, but you may be limited to what providers you can go to, what facilities you can use for those services. So think HMO, for example, where you are required to stay in network. And they're usually only good in the service area that you reside in or your county of residence, although in a medical emergency, emergencies are covered no matter where you're at in the U.S. But of course, cost sharing and benefits could be different than original Medicare because you're in an Advantage plan. And then just to make things more interesting, there are many different kinds of Advantage plans. You got HMOs, preferred provider organizations, Medicare fee-for-service Advantage plans, special needs plans for specific populations, programs of all-inclusive care for the elderly for specific populations. They do have Medicare savings accounts, although none are currently being sold in Colorado. There are also no demonstration projects in Colorado under Medicare. If you want a complete list of all the plans available in specific counties of Colorado, the best way to do that is to go to the Medicare.gov website and search for drug and health plans. You can call 1-800-MEDICARE and they'll get your zip code and tell you what plans might be available in your area. Or if you go online or call 1-800-MEDICARE and look at the Medicare and You handbook specific to Colorado, it will list all the plans available in Colorado. I'm not going to go over the differences between the different types of plans because of the time frame that we're trying to get this done in. But again, if you can get the link that you were sent in the reminder email that takes you to the different documents that go with this presentation, there is a handout that goes into detail about the different types of plans, how they work, pros and cons, that kind of stuff. It's really a very good handout with good information. If for some reason somebody can't access it after this presentation, feel free to shoot us an email and we'll make sure you get a copy of it. Again, you have rights, even in an Advantage plan when you're on Medicare, you have right to access to healthcare providers in these plans. You have the right to know how the providers get paid by these plans. You always have a right to fair, efficient, and timely appeal processes, and in some situations, expedited appeal processes. You always have the right to get the healthcare services that you need, to receive information about your plan in easy to understand language. And of course, you have the right to have your personal medical information kept private. If you're looking at this type of coverage or you want to try Medicare Advantage plans, there are some things that you need to take into consideration. If you're getting a Medicare Advantage plan and you take prescription medications, you absolutely want to make sure that whatever plan you're looking at covers your specific medications. Medicare Advantage plans with drug coverage and standalone Medicare Part D plans, each will have their own individual formulary or list of drugs that they cover. And so you want to make sure whatever you enroll in when it comes to drug coverage covers your very specific medications. If you have doctors that you want to stay with, you certainly want to check with them to see if they accept any Advantage plans or not. If you have a medical hospital preference, I know that used to be an issue here in El Paso County, that you might want to see what hospitals are contracted with any Advantage plan. If you have health issues, pre-existing health issues that require that you see specialists, you want to make sure that you understand the Advantage plans process for getting referrals to see a specialist, because that might require a referral from your primary doctor every time you need to go to a specialist in some situations. Some services may require prior authorization from the Advantage plan. Those are the types of questions you need to ask yourself and the plan before you enroll in anything, to make sure that whatever plan you do enroll in is actually going to meet your needs. This is the cover of the handout that I was describing a few minutes ago that talks about all the different types of Advantage plans and how they work. Very, very good handout to have when it comes to trying to figure out these plans. All right, so that's Advantage plans in a nutshell. I'm sorry, I'm trying to get this done in the time allotted, and my voice is starting to go because this is my third presentation today. So that's original Medicare A and B, Medicare supplements, Medicare Advantage plans. There are programs available out there for people who have limited or low income called Medicare savings programs. These are federal programs specifically designed and solely designed to help people with the costs of Medicare. So Medicare savings programs have 3 different levels of assistance that you can qualify for. At the highest income limit, the highest income someone can have and still qualify, which is the QI1, it will pay your Medicare Part B premium so that it is not deducted from your Social Security if you qualify based on your income and asset level. And at the lower income and asset level, not only will it pay your Medicare Part B premium so that they don't deduct it from Social Security, but it will also cover your Medicare deductibles and co-insurances. The income limits for 2023 are listed on the screen. We do help people at our SHIP office here, and most SHIPs will help people with applying for these programs and screening for these programs to see if you're eligible. The way they're applied for is actually through the local Medicaid application. But again, these are not Medicaid programs. They're federal programs that are specific for Medicare population. If anybody has any questions or want more information, contact your local SHIP. Give us a call. Then the last thing we're going to talk about, hopefully real quick, is Medicare Part D, D for drug. Medicare Part D is actually the newest benefit of Medicare, the newest part of Medicare officially. Came into effect in 2006. So Medicare Part D is the drug benefit of Medicare. It only covers outpatient prescription drugs where you go to the doctor hands you a prescription, you take that to the pharmacy. That's what Part D covers. Again, all Part D plans, whether it's a standalone drug plan that you would purchase in addition to a supplement or part of your Medicare Advantage plan, each one of those plans will have their own formulary or list of drugs that they cover. But each plan is required to cover a range of drugs. They're required to cover at least 2 medications in every medical class of drug out there, so that every class of drug is provided for under any plan's formulary. But that is why each formulary will vary from plan to plan, because if there are 20 different drugs out in the market that help with high cholesterol, each plan only has to pick 2 of those high cholesterol drugs on their formulary, and each plan could pick 2 different drugs. That's why it's important to make sure that whatever plan you enroll in covers your very specific drugs. If you buy or if you enroll in a standalone Part D plan, you will have a monthly premium. Whether you have a standalone plan or it's part of your Advantage plan, you will have potential copays and deductibles at the pharmacy. But again, for people who have limited or low income, there is a financial assistance program specifically that you can apply for that helps with Part D expenses. So should you enroll in a Part D, just like any and every other part of Medicare, it is optional. Nothing says that anybody has to enroll in any of this. This is all optional. However, if you don't enroll when you're first eligible and you try and wait until you absolutely need it because now you have medical problems, that's why they impose penalties. So it is optional. To be eligible to enroll in a Part D, you only have to be enrolled in Medicare Part A or Part B or both. You don't have to have both A and B to be eligible to enroll in D. If you already have other creditable drug coverage, meaning you have coverage through the VA, if you have coverage through a retirement benefit from your employer, if you are retired military or federal civil service or public employee, and you use those retirement benefits, they all come with creditable drug coverage, which is what that means is the drug coverage that you are currently enrolled in is going to be considered as good or better than what Medicare Part D can offer you. And so you would not need to enroll in a Part D because you already have coverage better than Part D. And if for some reason down the road you lose that creditable coverage in the future because it was considered creditable, it would allow you the opportunity to enroll in a Part D without any penalties later. You also want to take into consideration the cost of your current medications, especially if you currently have coverage. Is it more cost effective to get those medications through a Medicare Part D or through your current coverage or other means? Are you going to have to pay a premium? And if so, what's the premium for the plan that's going to give you the best deals? But again, if you choose not to enroll in a Part D simply because you don't currently take any prescription drugs, not because you have other creditable drug coverage, if and when you choose to enroll in a Part D during an open enrollment period down the road, they will penalize you in the form of a late enrollment penalty, which will be calculated and tacked on top of a Part D premium every year, every month, every year. And again, penalties never go away once they're incurred. Same enrollment periods apply to Part D as they did to Medicare Advantage plans. So I'm not going to go over this slide again because we've talked about it multiple times. Penalties for Part D are calculated differently than the penalty for Medicare Part B as in boy. Part B penalty was 10% per year. The Part D as in drug penalty is going to be calculated at 1% per month. For every full month that someone does not have or is not enrolled in a Medicare Part D and does not have other creditable drug coverage in place of that once they become eligible. And again, penalties are just to discourage people from waiting until they have a expensive prescription medication or high medical need before enrolling in benefits. So 1% for every month that you did not have a Part D when you should have or could have, that will accumulate over time. So if you wait 2 years to enroll in a Part D because you simply didn't take any medications, but you didn't have other coverage, when you go to enroll the next open enrollment, they're going to look at how long you went without. 2 years equals 24 months. 24% will be multiplied by whatever the national Part D premium average is the year you enroll. This year it's $32.74. So they take that 24%, multiply it by $32.74. Whatever that comes out to will be tacked on top of the premium every month for whatever Part D plan you enroll in. If you enroll in an Advantage plan that has no premium, you'll still have to pay that penalty every month. And of course, the longer you wait, the higher that penalty gets. The worst part about the Part D penalty is that it will vary from year to year because as the national average Part D premium fluctuates from year to year, it'll be recalculated every year. So this year, the national average premium is $32.74. Next year, it could go up to $40. And that 24% in January will be recalculated, multiplied by $42, is what I meant to say. Next year will be recalculated based on that higher national average premium. So you'll end up paying a higher Part D penalty every month, and it will fluctuate from year to year. Part D premiums are also means tested like Part B premiums. So the higher your annual income, the higher you could pay as a base premium for Part D. This is not a penalty. This is just the more you make, the more you pay kind of thing. Calculated the same way based on the most current complete tax filing. And as your income fluctuates from year to year, so will the need to pay a higher premium for Part D or B. So the way Medicare Part D works, Medicare has created a basic outline of coverage that is the minimal amount of coverage any Part D benefit can offer you through any company or any option. And that minimal outline says that there will be a deductible every year at the pharmacy. This year, the maximum deductible is $505. Once that deductible is met, meaning you've paid full retail price for all your medications until you've spent $505 at the pharmacy. Once that deductible is met, the next time you go to the pharmacy, you should pay a much lower cost for your medications in the form of a copay. Technically, that copay would be 25% of the retail cost that you've been paying. So you'd pay 25% as a copay. The Part D plan that you have would pay the other 75%. And that would continue after deductible until you had a total drug expenditure of $4,130, meaning they're going to take the amount that you paid in retail. And even once you start paying just a copay, they're still going to take the full retail cost of your drugs and continue to add those costs up every month until you hit $4,130. At that point, you'll reach the next level of your Part D coverage, called the coverage gap, used to be called the donut hole. And once you reach that level of coverage within the calendar year, your costs at the pharmacy could change again, and you would go back to paying 25% of retail. Now, you may be looking at me and saying, but that's what the previous level of coverage says is 25%. The difference would be the initial coverage zone after deductible. Technically, the most they could charge as a copay at the pharmacy, any of these plans, is 25%, but 99.9% of all Part D plans do better than 25% after deductible. For example, many plans have zero copay generics or $1 or $2 copay generics after deductible. So if you're paying those low-cost generics, they're still taking the retail cost of your drugs to add them up to hit that $4,100. And if you hit that mark and you go to the pharmacy the next month, instead of zero copay or $1 or $2 copay, you're actually going to pay 25% of retail. And while you're doing that, they're still going to continue to add costs to that column that got you to the $4,100. And if your total drug costs during this coverage phase reaches another $5,083 and change, you'll hit the last phase of your Part D coverage called catastrophic. And your cost would go down at the pharmacy again to 5% of the retail cost or less, or a copay of, actually, I need to change this, $4 and change for generic per month, or $10 and change for a brand name per month, whichever is less. This formula is going to kind of change for the better next year. So that if you hit that catastrophic coverage, your costs are almost eliminated, and then the coverage gap they're reduced. And we'll have more information about that during open enrollment. So this is the basic structure of any Part D plan, whether, again, it's standalone or through your Advantage plan. It all works the same way. It's all considered your Part D. In order for a drug to be covered by a Part D plan, it must be available by prescription only and written by a medical professional qualified to do so. It also must be a drug that is approved for use in the U.S. by the FDA. and it has to be prescribed for its medically intended purpose. What that means is that if a doctor is prescribing Viagra for high blood pressure, that is not the reason Viagra was originally created. So that prescribing it for high blood pressure was not its medically intended purpose and would not be covered under Part D. All Part D plans must cover drugs, biologicals, and insulins, and the supplies for injecting insulins. And all plans must cover both brand name and generic drugs on their formulary. Things that are not covered under Medicare Part D are going to be anything that would be covered under other parts of Medicare A and B. So any drugs you receive while you're inpatient in the hospital, any medications you receive that has to be administered in a medical setting, such as your doctor's office, would be covered under B. Those are not going to be covered under D as in drug. If it doesn't require a prescription, is considered over the counter, it's not going to be covered. Even if it requires a prescription, if it is specifically prescribed to treat anorexia or for fertility purposes or for cosmetic purposes only, not going to be covered by Part D. If it requires a prescription, but it's specifically a drug that's designed to relieve cough and cold symptoms only, not covered under Part D. Guaifenesin or Robitussin is a perfect example. And most vitamins and minerals, also known as supplements, are not going to be covered unless it's prescribed to treat a specific disease or condition. So such as prenatal drugs, vitamins to treat, say, Lyme disease, stuff like that. It has to be for a specific medical condition. But in general, most vitamins and minerals are going to be considered over the counter or not covered. That's Part D in a nutshell. Again, I mentioned that there is potential financial assistance for people just for their Part D benefit. The financial assistance is going to be based on limited or low income and resources. To apply for financial assistance on Medicare Part D, you will actually apply for it through Social Security directly. There have been, as of the end of this year, different levels of assistance someone can qualify for this help with Part D, but come next year, those levels will be eliminated. So anybody who qualifies for any financial assistance on Part D will get the full amount of assistance that is offered. You can apply for these programs either on the Social Security website by calling the toll-free national number for Social Security, or you can call us, your local SHIP office, and we're happy to help. Income and asset limits for help with Part D are higher than the program that assists with your Medicare Part B costs. So more people should qualify for help with drug costs than qualify for help with the Medicare A and B costs. Income and asset limits are shown on the screen. And again, we do assist people with screening and applying for these programs. The application for this particular program takes less than 10 minutes. It's really, really easy, and we encourage everybody to apply. If for some reason you don't qualify for patient or for the extra help or the financial assistance on Part D, you may still be eligible to get financial assistance through other means, such as patient assistance programs, which is financial assistance from the drug makers themselves. They typically will have much more generous income and asset limits to be eligible for assistance, but you typically have to prove that you were turned down for the financial assistance through Social Security. And I've listed several websites that we have used in the past that help you discover whether or not any of your current medications have patient assistance available through the maker of those drugs. And I think that's about it. Hopefully I didn't go over time too much. Resources available. If you have other questions, Medicare publications, the Medicare New Handbook, you can go to the Medicare website. You can always call 1-800-Medicare. Again, they're available 24 hours a day, 365 days a year. Pre-recorded or previously recorded presentations that go into more detail, or you can always look for any upcoming informational presentations on our website. We also, under the SHIP program, has a sister program called SMP, or Senior Medicare Patrol, where we help educate people on fraud and abuse of Medicare and Medicaid. And we help people determine if that's happening to them. And if you have any questions about claims or doctor's bills or enrollment or marketing issues, you're always welcome to call us and we're happy to help you figure out what's going on. We are grant funded, so we are always, of course, looking for people interested in volunteering to do Medicare counseling or help with any other aspect of the SHIP program. And if you have any interest, it's a lot of work to learn, but it is incredibly rewarding to be able to make such a difference in educating people about such an important topic. And so you're welcome to give me a call, and I'm happy to talk to you about those opportunities and our contact information. Always happy to answer questions. Give us a call. And don't forget, open enrollment is right around the corner. Official first business day of open enrollment is Monday the 16th, so 2 weeks from now. And we will start taking calls to schedule appointments, I think this week. We'll start taking calls to schedule those appointments if anybody's interested in sitting down or talking to a counselor for that purpose. Just give us a call. And with that, I am done.
Thanks, Roma. Before we open it up for other questions, do you mind if we do our gift card drawing?
Absolutely.
Awesome. Okay, so it's going to have me take over the screen share really quick, but then I'll happily give it back. Okay, so I've got every name on here from just a moment ago, so I'm just going to click to spin, and let's see who our lucky winner is. Is going to be so if you wouldn't mind sending me a quick email, I'll send you a personal message just with my email on here. Then I can get you that gift card of your choice. So I will stop sharing and send that over.
Awesome. Congratulations. So does anybody have any other questions? If you have questions, you're welcome to type them into the chat box. Do we allow people to unmute and simply ask their question?
They can if they want to. They certainly can.
Absolutely.
So there's a lot of information today, folks, and you will be getting, I think there was a question in the chat, you will be getting a follow-up email with the links to the handouts and her PowerPoint presentation. So everything she went over, you will have a chance to digest in more detail and your own time frame. And because, as you know, this is a lot of information to consider. So if there's no questions, okay, well,
again, I thank everybody for sitting through all of that, and certainly reach out to us if you do have more questions. Otherwise, have a good night.
Thank you, Roma. Thank you. Thank you all for being here. I know Bree probably wants to say a few words, but we appreciate you being here. We will be having a 2024 session next year. Look for that. And please take the survey. So, Bree, did you want to add anything before we quit?
Just another message of thank you. And thank you very much. Yes, the survey really helps us shape what year 10 will look like. So we couldn't appreciate that anymore. And just want to thank you all. Thank you, Pamela, for this partnership. And look forward to seeing you all again next year.
Great. That's great. Thank you, folks. And Jared, it's all yours.
Thank you, Pamela. Thank you, Bree. Thank you, Roma. And thank you all for taking the time today for joining us in this Reframing Retirement event. We hope this information was helpful for you. This is the final session of our 8-part series. And if you want to review any of the materials, you'll be able to watch it for on-demand viewing starting tomorrow afternoon. If you missed any of our earlier sessions, you can view the materials and the recordings of most of those sessions online at ppacg.org/reframingretirement. You'll receive a survey after this webinar is complete. And as everyone has said, we would greatly appreciate your feedback on your thoughts in this webinar. Thank you all for attending and have a great evening.